Quick Takes Madison Mills is here to explain what the data reveals about the Moderna shots. Madison, thank you so much for joining us, and tell us, what were your big takeaways from today's big data drop?
Right, Renita. So another really exciting and hopeful day on the vaccine front here in the U.S. U.S. regulators said that the Moderna vaccine is 94% effective. And what's even more striking about this data is it showed that it was 94% effective across racial and ethnic minority groups, as well as with those who had underlying medical conditions. So very exciting preliminary data here. But the question, of course, remains, Renita, we say this every day, when are we going to get it? So the next big step is the Food and Drug Administration has an external panel of advisors meeting on Thursday. That panel is going to review all of the raw trial data from Moderna and make a decision. They're going to vote at the end of the day as to whether or not to recommend that the FDA approve the vaccine for emergency use. Then there's another vote on Friday. FDA officials will have to meet again to vote on whether or not the vaccine should finally be approved for emergency use. And if they do vote to approve it, which they are expected to, the shots will get distributed as early as Monday.
Now, that's what's happening with Moderna. Meanwhile, the Pfizer vaccine, this was one day after it got doled out across the U.S. What are some of the biggest differences between the Moderna and Pfizer shots?
Right, so I did speak with our COVID expert, John Lauerman, earlier today, and he stressed to me that there's really no difference that anyone should be worried about, but it is just interesting to know the differences here. So just to walk through a couple of them, one is really the temperature. The Pfizer shot has to be kept at such low temperatures, so it's a little bit harder to transport. That means the Moderna shots could have less snags in the production and shipment process. Also digging into a few more bullet points for you here, the Moderna shot is potentially more effective at preventing asymptomatic infections, which could be huge. They said that they only have preliminary data on this so far, but they're going to continue to look at it. We'll continue reporting it, of course. And if that ends up being proven by Moderna's data, that would be huge, right? Because we know that asymptomatic carriers of the virus are typically those who are more likely to spread it in the U.S. So we'll keep looking into that as the weeks go on. Also, one key difference is that doses 1 and 2 of the Moderna shot are separated by 4 weeks. For the Pfizer shot, they're only separated by 3. So you will have to wait 1 additional week to get the effects of the vaccine if you get the Moderna shots.
And we are waiting for more information on that. Meanwhile, the FDA authorized today the first over-the-counter at-home COVID test. Tell us how this test works and how this could possibly affect our handling of the pandemic in the U.S.
Right, so another really exciting development today, the first over-the-counter test for COVID is available, and you don't need a prescription for it. So you could walk into a Duane Reade, a CVS, and get this at-home test. It's a nasal swab, and it's really easy. It's like a Q-tip that you stick into the end of your nose, and then you put that into a solution, and you get the results in about 20 minutes to your smartphone. So this is huge for things like contact tracing, right? But some experts are a little bit concerned because, as we saw right before Thanksgiving, so many people got tested, and they used those test results to kind of validate their decisions to travel for the holidays. And now we're feeling the effects of that. We're at an all-time high of cases and deaths. And so experts do want to make sure that people aren't using something like an at-home rapid test to justify things like having a party, for example. You still need to keep up public health measures like social distancing and wearing masks, even if you get tested.
Now let's switch over to government officials, where there's been this ongoing controversy over whether some of them should be moved to the front of the vaccine distribution line or not. What's the latest on that?
Right, so we heard from Dr. Fauci today. He said that he believes, for government security reasons, that both Trump and Pence and Biden and Harris should get the vaccine as quickly as possible. And like you said, Renita, this has been a point of controversy. Some people believe that these high-up officials getting the vaccine first could be perceived as them using their power to move themselves to the front of the vaccine line. But other people point out that there was a study today that showed 25% of Americans are not going to take the vaccine because they don't trust the shots. And so seeing huge officials from both sides of the aisle taking the vaccine could be big for building public trust in the vaccine. And again, that's something that Dr. Fauci spoke about today. He said that seeing both Trump and Biden publicly taking this shot could be a way to instill public trust in the vaccine. And that's what we need to be able to move forward from this pandemic.
One more quick question before you go, Maddie. We know the FDA is supposed to approve this shot on Friday, but what will happen immediately following that?
Right, so if the FDA does approve the shot for emergency use on Friday, Moderna officials will have a very busy weekend. They'll be reviewing documents that they'll be sending out to physicians who will be administering the shots. Also, the shots will start getting distributed from distribution hubs to hospitals so that they can be in the hands of providers as early as Monday. Also, quickly, I want to point out to you that Moderna has 6 million doses available as opposed to Pfizer, who only had about 3 million available last week.
The numbers are important. Maddie Mills, thank you so much for joining us.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.